don't feel good.
You don't feel good?
No parent wants to hear those words, especially if a child's illness takes a turn for the worse. But as pediatrician Cynthia Cross-Thomas points out, there are a few guidelines parents should keep in mind to make the situation easier to handle.
Just planning ahead of time, knowing what to do or what you're going to do in case there's an emergency. It's always nice to keep your doctor's after-hours number handy. It's also a good idea to be familiar with your insurance and where that insurance carrier wants you to seek medical care.
It's also helpful to make a complete list of your child's allergies and medications. But once your child gets sick, how can you tell if it's time to head to the emergency room?
First off, some of the emergencies or what dictates an emergency are governed by how old your child is. So a kid who's under 2 months, fever is a medical emergency. Kids definitely who are 3 or more who have fever and say cold symptoms, they're not having any trouble breathing or drinking fluids okay, then see their primary care physician. Now if things change, i.e. they can't control the fever or the kid gets a bad cough or they're having trouble breathing, then those kids need to be seen sooner.
If your child should require a trip to the ER, the pediatric ER is where you want to be.
It's not just an adult ER with a few things for kids. This is actually a fully functional pediatric emergency department. The equipment's child size. We have the capability to do a full-scale resuscitation here in this department. We have all the airway equipment, rescue equipment that we need. The physicians are licensed in pediatrics. We're actually pediatricians who render emergency care to children.
It's not just the specialized attention to children that appeals to parents like Cannon Barksdale, whose son Tate was admitted after experiencing a bad fall.
The time frame is the biggest because when you go into a regular emergency room, you're mixed with all the adults and everybody, so the time frame's longer. And we come here, it's a lot quicker because it's just pediatrics.
The surroundings also play a big part in easing the fears of little ones.
I think it's a bit more of an intimate environment. It's kid-friendly, so we have the wallpaper and we have toys for the kids to play with. We have a treasure box, we have stickers.
Everybody's a little bit more concentrated on kids and kind of like going to a nursery.
This ER also has a pediatrician on staff 24/7, pediatric trained nurses, and a child life specialist to help children understand their treatment.
Have you ever had an IV before? No? Okay. Well, this is Buttons the bear, and he has an IV, and I was just going to show you what they're going to do.
The fear of the unknown is magnified when you're 5 years old because they have quite an imagination, and they imagine it's going to be extremely painful, and it's really important to give them something to expect that's realistic rather than just letting their fears get the best of them.
You're all better, huh? You feel better? Is that so bad?
That wasn't so bad.
Good girl.
Those are the words every parent wants to hear. For Smart Medicine, I'm Lorraine Cachola.